Nothing contained in this podcast should be considered a substitute for professional medical advice. This content does not represent our respective employers and is purely the opinion of the podcast hosts. We are not your personal medical providers. Sorry, friends. So, if you have concerns or are seeking a diagnosis or treatment, please seek individual advice from a healthcare provider in your area. We are not liable for any risks associated with acting upon the information contained in this podcast. This is intended for educational and entertainment purposes only, so enjoy the ride.
Please drink responsibly and in moderation. Before drinking, please be sure to be of the legal drinking age for your country. We do not encourage the misuse of alcohol.
Welcome to Medical Media Mixer, the perfect cocktail. I'm Nicole Peniston, psychologist.
And I'm Tara Prisco, physician assistant.
And the countdown timer.
It worked for me. Yes, I am the countdown timer.
That is your new job, countdown timer.
There's a show that I've been binging that you need to watch all of it, and then you can cover things for episodes.
I've probably seen it.
The Hunting Party?
Yes. Of course. I saw it as soon as it came out. Yes.
Okay. I'm in the second season, but it's like I've only been watching it.
I get confused. The Hunting Party or the Hunting Wives?
No, not Hunting Wives. Yeah.
Okay. I mean, no. I watched the Hunting Wives. I started the Hunting Party, but I need to get back into it.
The premise is the jail, the big prison with all these serial killers.
Killers get out and they have to round them all back up.
But they throw out...
And Kelsey Grammer's in there.
Yeah, he's in the episode I just watched. He's a cult leader. So that's in the second season. So did you see something in the second season, but not the first?
I just saw like the previews about it.
So they, number one, obviously serial killers. Number two, it throws out all of these like random types of therapy. And then of course, all the experiments they're doing on people. I don't know if some of the names of these types of therapy are like things that ever were really looked into or if they're just making shit up. So I need you to decode all that and tell me what's real or not real.
Okay.
But it talks a lot of psych stuff in there. Plus serial killers, they're always, our thing.
Always fun times. Yeah. I've been watching a lot of Housewives lately, so I mean, there's plenty of stuff there I could cover as well. But
yeah, this show I don't know. I finished that show Paradise up to the end of the second season, and I was like looking for something, and it was just like flipping through, and this is on Peacock, and I was like, all right, I'll try it.
Nice.
And so I've been binging it because it's just easy because everything is like episodic. Like, yes, of course, there's a backstory, but just like SVU or one of those type of shows where like each episode, closes one singular story too. So kind of easy to watch whenever.
You know what I watched that I think you would enjoy? And I can't cover on the podcast because I just did a full episode on it, but it's called The Unchosen on Netflix. It's basically about a cult, but there's more to it than that. But I was shook. From the preview, I did not think I was going to like it. And then I turned it on and I was like all in. It's, I want to say 5 or 6 episodes.
Okay.
Really good though. But like based on the preview alone, I didn't think I was going to like it. And so I just had it like playing in the background while I was working. And then I stopped working and was just like focused on it. It was good.
I know this one we talked about in person, but never on the podcast is the false prophet guy, the Phil DS guy. What's the name of the actual documentary?
Warren Jones.
What is it? No,
the new one. It's called Trust Me, the False Prophet.
Me. Yes. That one is, we talked about it in person, but we didn't talk about it on the pod.
Gnomes is going to be on one of the podcasts on the Exactly Right Network because I just heard it advertised today.
Really? I have to listen to that. So do you know who she's dating now?
Warren Jeffs.
One of his kids.
I mean,
who also escaped life sort of a thing. And so, right. I don't know. Like, what is going on here?
Listen, Gnomes, I love you. I love how fierce you are and how it seems like you would cut a bitch. I appreciate that.
She would.
But girl, like, just be you and be yourself for a little while before you start dating. Like,
exactly.
Get to know who you are and what you want. Yeah.
It's craziness.
Yeah. But whatever, follow your heart, Love yourself, girl, as in the immortal words of RuPaul. If you can't love yourself, how in the hell are you going to love anybody else?
See, who knew that RuPaul would give that amazing advice?
I knew. I've always known.
That's one thing we did not do was our drag names on our last call.
I mean, see, that's another hard one because there's so many good ones and you can't really repeat.
Right. Yeah.
Yeah.
We'll have to think hard on those. Drag name.
Yeah.
There was something else I wanted to tell you. I had like things in my head. Like that show was one of the things I wanted to tell you.
Well, I didn't tell you what I did with Deborah for Mother's Day.
Oh, yeah.
We went to a Bridgerton-themed brunch and bouquet making. Yeah, it was
Ooh.
fun. It wasn't like bouquets, it was more like mini centerpieces, but it was very fun. It was like a little brunch, and the majority of people dressed up Bridgerton-like.
Did they? Oh, that's cute.
So it was an excuse to buy a new dress and wear my little crown because I
That's
wasn't
so
going to wear my actual Bridgerton
Yeah, that's
cosplay.
a
I felt
little
like
too
that was too
much.
much. And I'm glad that I didn't, because when I went there, it was more people dressed like Easter best, like hats and
Right.
like flowery dresses, that kind of thing.
Right.
So,
Oh, that's cute though.
but it was funny. Deb wore a black fascinator and like this black outfit and like a black lace thing. And she's like, I'm like Lady Grantham. I'm in mourning. I was like, oh my God, stop it. She was ridiculous. Pure Deb style.
I do love Lady Grantham though. She's my
Yes.
bitch.
Yeah. Yeah. What is this weekend that people speak of? But yeah,
So many
we had a
things.
good time, and it was nice. We got to make our own little flower centerpieces in like these cute little, like it looks like a purse, but it's,
Oh, that's so
you
cute.
got to pick your flowers and arrange it yourself, and it was fun. It was a nice time.
I like that. Was that local to you or
Yeah,
her?
it was
Okay.
local to me, but it's funny. My mother and I are very much alike in some ways. And I'm not upset about that. But in the one way that we are very much alike is that we can't really be around people too much because we get unfiltered. And
Oh,
so
no.
we sat down, like when we got there, they had like a few long tables and then like smaller round tables. So we sat at one of the round tables and it was like empty when we got there. So we knew people would be joining us. So we're sitting there and we're watching people walk in. I'm like, they're going to want to sit with us. And they did. And then other people came and sat with us. And then I was distracted by the people sitting next to Deb. And then there was a woman with a small child next to me. So I was also getting distracted by the small child. And she was just watching. And then we were kind of gossiping to each other about everything.
People watching is fun though.
Yes. But it was fun. And they had like a cute little photo booth like you had at your mom's party. So I got cute pictures. And so, yeah, it was a fun time. And then we went for ice cream afterwards.
Everything ends best with ice cream. Actually, last night I ordered like DoorDash Rita's
nice
Italian ice and custard. I was like, we need to end this day with ice cream.
Yeah, I can't really eat ice cream, so I got a very small milkshake and drank like half of it.
Yeah, but a little taste, just a little bit.
Well, and I realized, I don't know if it's related to my undiagnosed GI issues or other multiple health issues that I had, but after I had and it was like small, it was like this big. I had like half of that. I just felt exhausted for like hours afterwards.
Yeah.
And like I didn't have any problems. I felt so tired. And I was like, well, I only had like a couple of drinks at the thing. It wasn't that. So
yeah.
I think maybe it takes me longer to digest it and then that makes you tired. But that's why I don't eat that much red meat either. Because I definitely have made that association.
Yeah, it's a little too much.
Yeah. I like it, but then afterwards I regret it.
Yeah, it's like, ugh.
If I'm going to regret something after, it's going to be a drink.
There you go. And the reason, I don't usually drink now on our first recording is because on Mondays when we record generally, I go to my in-laws, so I have usually 2 glasses of wine there.
Oh, I did not know that.
And then we record, so I have like a seltzer or something, and then I go next.
You don't want to get wild on a Monday night?
And I don't want to have a headache and all
on
that.
a Tuesday during work. I get that.
I want to be able to go to work.
Yeah.
Like in good spirits.
Yeah, I'm not chugging this because I have a presentation and an important meeting tomorrow morning.
Yeah, you have a lot going on tomorrow.
I mean, it'll be fine, and I'm as prepared as I can be. It's way more than my typical Tuesday, so I'm feeling a little kerfuffled about it.
That's a good word.
Thanks, I try.
Tomorrow I have to take oldest child for her math placement exam for her high school.
Excited.
Next year, I told you this, but I didn't say on the pod, but my kid got into this really, really hard to get into STEM magnet school in our county. And it's a biotechnology based type school. And it's really cool. And, she gets like literally like straight A pluses. Like I really can't complain.
I was going to say, and where did she get that from?
I don't know, because like honestly, I did well in school, but I didn't do like straight A plus and everything.
You probably ranked higher than I did.
Maybe just because I had more honors classes, so they pulled the ranking up.
Yeah.
But
I literally thought I was stupid until I got to college, and then I was like, oh, I'm like the smartest person here. Like, I don't think I realized, and maybe you didn't, I don't think I realized quite how academically competitive our particular class was.
Right. Our class was. We had a lot of smart people.
And I think it's because we just had all known each other for so long, we didn't
Right.
really think any differently. We thought everybody was like that.
Everybody was like that. It's true.
And then, we have 2 people who got perfect scores on the SATs,
Oh
and
my goodness.
and one of them was high when they did, but good for them.
Yeah, this kid, don't tell her I said this, but I think she's smarter than me and the husband. I think she's
Oh, I'm
naturally
totally
even
telling
smarter.
her immediately. Get her on the horn. Come on over here, girl.
Hey, you know what? She's gonna rule the world one day, even though she's a pain in the ass. She's gonna rule the
That's
world.
usually how they are.
Yeah, pretty much. So yeah, I get to leave work half day to go drive her over for that
Mhm.
exam. So
Fun.
that's not bad. Yeah. All right. So I have today's topic, and my drink is super easy and light and like just fun.
Mhm.
And it's like, it's called the Mountain Sunrise, and you can see by the color
Mhm.
why it's called the Mountain Sunrise.
For those who are not watching on video, it's orange.
Yes, it is. And so what's interesting though is the whole story behind this cocktail is that it was, let me give you the exact details. So Mountain Sunrise, MS,
Mhm.
is because the topic is going to be MS.
I see what you did there.
Well, I didn't even do it. Somebody did it. So in Arizona, there was this, it's in the Phoenix something website. Phoenix Mag.
Mhm.
It was a recipe for this guy, Scott Sanders, CEO of this Octane Raceway. And they were doing some sort of a charity event because his wife was diagnosed with MS 8 years prior. And so he was hoping to raise money from this cocktail. So that's where the cocktail recipe came from. So it's 1.5 ounces of citrus vodka, 1/4 ounce of peach schnapps, 3 ounces of orange juice, and a splash of grenadine, or as much as your heart desires, I guess. Put it all in a cocktail shaker with ice, shake, and then put it in, pour it over ice. You can put an orange slice or a cherry. I did go and buy an orange, and then I decided that I didn't want to slice it.
You bought an orange.
For this, I'll eat the orange tomorrow, but I bought an orange and I was like, I don't really need to slice it and garnish it. It's fine. So, but you can, if you want to feel nice and cute and fancy, you can absolutely do that at home. And it tastes basically like you'd expect it to taste. It's like a screwdriver with a slight, with the peach and the grenadine, that little extra something to it. So
It sounds
it's pretty
delicious.
good.
I had peach bellinis at the Mother's Day
Ooh,
brunch, which were
yummy.
delicious.
Okay, so let's get back up to talking about the documentary. I did this. I did my AI friend give me. Oh, here we go. All right, there we go. I'm like, where are you? Why are you talking about this?
I was going to say, are you mad at Claude again?
Yeah, it was because it was like talking
give
about
the man
some
a break.
old message from a while ago. Right.
He's doing the best he can.
We're talking about the documentary introducing Selma Blair.
Mhm.
It was in 2021. It feels like it was more recent, but I guess it wasn't.
I saw it like right when it came out, like probably like 2 weeks after it came out.
So it's a documentary that follows the actress Selma Blair in the year following her 2018 MS diagnosis and all the way through her treatment, which we'll talk about. And it sort of jumps a little bit around the timeline and you sort of learn her story through it, but it shows that she's living with like very severe disability. She has a foot drop. She has balance issues, cognitive issues, fatigue that can be debilitating.
So I have a question, and you might get to this.
Yeah.
Is that the typical presentation, or would you say that's a more severe presentation?
So,
because it seemed severe to me, but I know it kind of comes and goes.
In that, right. So we'll get into relapsing remitting.
Mhm.
She does talk about how she likely had this for 15 years prior.
Yeah.
And so that's where she got to here. Most people, it does take quite a while. I think hers was a little bit longer than the typical.
She was in her late 30s, early 40s when she got diagnosed.
She's around our age. So she was in her 40s. Yeah.
Yeah. Because I've, from what I've heard, what little information I know, and I'm sure you'll tell us more, is that it can be diagnosed as early as the 20s.
Yes. And I actually have a patient that I did diagnose about a little under 2 years ago with it, who similarly was written off. But
I have a family member who was diagnosed in their mid-20s with it. Yeah.
Yeah. So, basically this sort of the core arc of the whole thing follows like her plan to do this treatment. And we'll get into treatments, but what she decides to do is not quite the typical treatment. And it's like an off-label use at this point. But the documentary did win a Peabody Award, and it definitely was well received. So I'm going to give you sort of her timeline. So that's what I used Claude to help me, because the movie jumps around for her timelines.
I will say, before you get into it, I watch a lot of difficult things and deal with a lot of difficult things day to day, but I got really emotional during this.
Yeah. No,
it's very touching.
It really is. And we'll talk a little bit about her presentation is very, very severe. 2003 on is when she feels like she probably had it. So an estimated 15 years of undiagnosed. She had so little minor symptoms at that time, right when her career was actually taking off. And she basically said since her son was born, she's never been okay. But her son's only, what was he?
I was going to say 7 or 8 in the documentary.
Yeah, he was pretty, But she feels like, I guess that probably stepped things up a bit.
Is that common?
Yeah, I mean, any kind of insult to the immune system can set off an autoimmune disease on a further path. So that does make sense that was a tipping point, but that she already probably had something and that just tipped her into where she is now. So she was going to doctors, simply said nothing was wrong, that it was baby blues, postpartum stuff, thinking she made it up, like we've talked about with.
Well, I feel like with women, it's either blamed on hormones or anxiety.
Right.
One or the
they
other.
said stress, depression, demands of single motherhood. But all of this sort of peaked. And what's funny is until I saw the documentary, I forgot about this. But the 2016 airplane incident where she had
where they alleged that she was drunk on the airplane and escorted her off.
Right. Well, she said she was drinking. She did say in the documentary that she was drinking, but she had basically a public meltdown while traveling from Mexico to Los Angeles with her son and his father. She had been drinking heavily before the flight, probably self-medicating to a certain extent. And she acknowledges that she already had MS at the time. And then one of her symptoms was that her body...
So it was diagnosed at that time?
No, she had it, but she wasn't diagnosed till 18. This is in 16. But her body constantly felt like it was on fire, and it became sort of her rock bottom. And then she became sober after that. But her official diagnosis came in 2018. And basically, she said it came as a relief because finally, you can start to do something about it. All of the unknowing and sort of being dismissed, which again, this masquerades as everything and nothing sort of. I would say MS and lupus are sort of the two things that look like everything and look like nothing all at the same time.
Right. I think that's why I was confusing it with the alleged drunkenness, because I think at one point she makes a joke when she's having really bad tremors. Oh, it's like my meltdown, but I was drunk then or something.
Exactly. Because some of her slurring speech and things like that could look like she is now and her imbalance and things like that. But after she was diagnosed in August of 2018, in October, she went public. So she went on Instagram and stated that, I am a forthcoming person. I want my life to be full somehow. I want to play with my son again. I want to walk down the street and ride my horse. I have MS and I am okay. Now, I don't know because I don't have written here, but there's that iconic award show that she went to and
with
she
the
had
cane.
the cane.
Yes, and was rocking it.
Right. She looked amazing. She used it as sort of prop to pose, but also obviously as an aid that she needed. But
and now sometimes she'll take her service dog on red carpets now.
Oh, does she?
Yeah, she has a service dog who, not to every event, but to some events, she'll bring the service dog with her also.
Yeah. So, I mean, after that diagnosis, she really quickly deteriorated, and the treatments that she did try were not working, were giving her side effects, and her options ran out. She sort of ran through in a year, I guess, multiple things that did not work out for her.
And you're probably going to get into this, but I'm just clarifying for my own recall. She has the relapsing remitting.
That is the type, yes. Usually females get the relapsing remitting, but it does eventually become progressive after sort of an additive effect. Men are more likely to have the progressive type, and it's a lot worse trajectory with that. But basically, she was slurring, stuttering, she would have spasms, struggling to walk.
It would almost look like seizures in some of the footage.
Yeah, and then they showed her trying to write, with her hands, to try and write a note.
Yeah.
So she decides to do this sort of experimental off-label treatment, which is stem cell transplant. And she did this in Chicago, which there must be a study that she was taking part in because it's not an on-label thing. And it was at like a big institution. And when they filmed it, you could kind of see where she went through. So it wasn't like she was paying cash for something only celebrities get type of a thing. It must be a study. They didn't really clarify that, but
I mean, her
imagine
celebrity might have gotten her into the study, but yeah,
maybe.
it seemed like it was other people were also undergoing the same study.
So part of a stem cell transplant is that basically you have to have chemo to like wipe your body out. And so they show her like shaving her head and her son helping her shave her head before she goes. And then she has to basically have this chemotherapy to wipe everything out. And then, well, first they harvest stem cells. Let me go back. First, they harvest stem cells from her bone marrow before the chemo. Then they give her the chemotherapy to completely do like a hard reset on her immune system. It's like hard rebooting your computer, essentially.
And we talked about bone marrow transplants in our Orphan Black episode.
Yes. And so, it was not fun. You see her like swelled up, her face, her whole body was swollen. She just felt horrible. I mean, she was crying. She was isolated in a room because when your body's wiped out from that chemo, you have to be on isolation because you can't get any infections.
And I'm sure you don't really want to be around people when you're feeling that bad anyway.
It was rough to watch. She was at sort of a low point,
and wasn't she staying in a hotel at some point?
At some point
because she
was.
Couldn't travel back home yet. Like there was something about that.
Exactly. But, she did have a follow-up that was shown in the documentary, and it did show that she was in remission. Remission just means there's no new lesions. And we'll get into the specifics about what lesions are and all that. And now, post-documentary, she continues on IV immunoglobulin therapy. So that's an IV infusion of antibodies, essentially, every 2 weeks. For a 2-hour infusion. She still has some of that dystonia with her speech. Her speech was, to me, one of the most profound things. She still uses a cane, but she was interviewed on the Today Show saying she's feeling well, she's tired, but that's kind of where she is.
Yeah, and she's been a really big support and advocate for Christina Applegate, who more recently came out with her MS diagnosis, and apparently the two of them have really bonded over that.
Yeah. I find it interesting. So I don't know if you remember this part of the documentary, but when she's doing her intake for the study, I think she's already been accepted, but she has to go and do new scans and new this and new that. One of the doctors she saw wasn't like the main one, wrote her off and thought it was like factitious or no, they thought it was a functional neurologic disorder.
Which often gets lumped in with factitious disorder, unfortunately.
And, I understand that her physical presentation is a lot more significant than we're used to seeing with MS. It is. I mean, I believe, but she had lesions on her brain. So.
Well, and I have a theory about why she was written off. Because she's a famous actress. And there were cameras following her. So from a medical professional standpoint, who maybe is a little skeptical, is like, you're doing this for attention. Like, look, you've got the cameras here. Like, look, you're doing all this. Like, I don't think it's real. And I think it's unfortunate, but I think it was really good for them to show that because I think that's what a lot of real people go through.
Right. I mean, so I'm going to get into some stats, but, the particular patient that I diagnosed, she's in her 20s and she just had enough non-specific things that I felt something was wrong. Like she had GI stuff, she had dizziness, she had tingling or numbness. I don't remember the exact details, but whatever she had seen multiple people, another primary, a gastroenterologist, some other type of specialist. I don't think she had seen a neurologist particularly. Maybe she did. I don't recall exactly. But I was like,
and I've heard from different people about those initial symptoms can be very different. Like I heard of one person who lost their sight temporarily. It was for like a day or so.
Optic neuritis is that's actually one of the most telling ways to diagnose it. That's actually one that actually is easier to figure out.
Yeah. But yeah, I've heard the same thing of, these random cluster of symptoms and people get misdiagnosed or blown off. You'll probably get into it, but if not, because I know strangely a lot about MS for no good reason, but I know that studies have shown that it is more likely to happen in the northern U.S. versus other parts of the U.S.
I did see that, and I don't know exactly why. But
and I think that's the thing. They don't know exactly why, so it's kind of just this like one-off fact
thing
about it.
Yeah. And this particular patient, I just said, let's do an MRI of your brain. And then boom, the reading came back, and I was like, oh no. And I did send her to a neurologist, and then they did, the other studies is MRIs of the whole spine with contrast, and then they do these other things. They can do a lumbar puncture and different things. She didn't get an official diagnosis. She was on sort of a watching, waiting thing until she came in again with new symptoms. And then I was able to call her neurologist, and then they got her a new scan to show a new spot on her brain that wasn't there before. So it confirmed in time symptoms and a new lesion. And that is really the definition of how you get like a diagnosis in some circumstances.
And that's the unfortunate thing, is that you have to wait till it gets worse first, till someone believes you.
Right. So MS affects approximately 2.8 million people worldwide, with about 900,000 in the U.S. Strikingly, more North America, like you said, and Europe. Usually,
and I've heard it's even northern North America, like more often Canada, top of U.S. versus like
and
South America.
It says there's a strong latitude gradient. Yep, MS is more common further from the equator. And tends to be mostly in Caucasians. Women are affected 3 to 1. And the average age of diagnosis is 32, although it's typically presents between 20 and 30. And the prevalence has gone up about 10% since 1990, but probably more due to better diagnosis.
That's what I was thinking.
And better survival. So it's a combination of those things, not that it's actually occurring more.
I also I hear that with a lot of diagnoses, that more people are getting diagnosed now. And I also think the other part of it now is, I don't know the statistics on this, but the population is also growing. So there's just more people who possibly get it.
Exactly. It actually does say that. And population growth. That was the other part of my sentence. That I didn't read. But that's absolutely true. So, MS symptoms, like we mentioned, can vary very widely. It really depends on what part of the nervous system. So it affects your central nervous system. So that is your brain and your entire spinal cord.
I'm smiling because I know all this stuff.
I know you
can
know
do
all
the doctor
brain
side of it
and nervy stuff. Upper motor neurons, lower motor neurons, all those things.
Demyelination, the myelin sheath.
Correct.
I told you, I know way more about this than I need to.
Well, because, nerves in the brain, it's important stuff. But vision problems, like you said, blurred vision in one eye, something called optic neuritis. So you have big nerves that come from the back of your brain up from your optic chiasm and come up to your eyes. And so those big nerves, the optic nerves, are one of the very most common ways that this can present. And again, it's not pathognomonic because you can have optic neuritis and not have MS, but there's a high percentage of people who have optic neuritis that they are going to get a diagnosis with MS. So that can be one of those things that if you've got this, you've got to have all those alarms going off in your head, like this needs to be looked further into. You can have sensory changes, so just numbness or tingling in one section of your body, or pins and needles. Simple things like neuropathy in your hands or feet can be, and there's so many things that can cause neuropathy. And then weakness, poor coordination, balance problems. So like tripping and falling in like a young person that doesn't quite make sense. Double vision, problem with your eyes moving, so the eye muscle movement. And there's something, again, this is a French name, I think, Lehermit's sign, Lhermitte. Lehermitte? I don't know.
You said
but
it
basically,
right.
It's when you put your head down and you feel an electric signal go down your spine to your feet when you bend your neck forward.
That doesn't sound good at all.
Yeah. And then very commonly, you'll have bowel or bladder issues. So you can have incontinence or urine retention where you can't urinate. And then you could have same thing as far as bowel.
Which I never thought about, but considering it can happen in 20s to 30s in women, I'm sure a lot of women that was blamed on pregnancy.
Yep. Pelvic floor dysfunction. Yeah. And then, of course, fatigue and cognitive changes. So brain fog and fatigue. Everyone, how many people come in complaining of that? And so you have to have that sort of eye for when the symptoms sort of meet up and when you feel like we need to do more testing. And that's very tricky. It really is. And so
I also think, and I just know this from my own kind of experience, but I have a lot of times patients will come to me talking about like brain fog. And I always was like, okay, whatever, like you can't focus. And then I experienced brain fog post-surgery. That shit is no joke. It is rough and you don't feel like yourself. And I feel like since experiencing it now, when people, I didn't dismiss the symptom before, but now when people tell me about it, I'm like, okay, tell me more. Like, tell me the severity, the length. Where before I would just be like, okay, brain fog, next symptom.
Right.
Because I think the way that it can impair your functioning day to day is so significant. And because other people can't see it, you just push through and you just go through it. And it's like, no, this is serious. This is a big deal.
Absolutely.
And it can be a safety concern.
there's not like a definition of that,
Mhm.
right? So it's
Exactly. It's a
difficult
feeling.
to pinpoint.
Mhm.
Exactly. And so, like we said, these symptoms develop over hours to days. They reach their maximum severity within 4 weeks, and then they can improve. So
Yeah.
you can have that symptom by the time you're getting your first workup for it, or even
Mhm.
getting in with
Waiting for
somebody,
an appointment, yeah.
it can improve.
And that's why we call it relapsing and remitting?
Exactly. So 85 to 90% of patients have relapsing remitting MS.
Not
So those,
relaxing at all.
no, those are attacks and then periods of recovery. And
Kinda
then the
like a lupus
remaining,
flare-up or things
right,
like
a
that.
flare up. The difference with this is after a certain period of time, well, I guess similar to lupus too, that some damage is done
Mhm.
eventually. And then the primary progressive is the other part, which is much more like a gradual worsening steadily from
Mhm.
the beginning to the end, more prevalent in males, much worse outcomes with that. So like I mentioned that MS the criteria, it's called the 2017 McDonald criteria. So it has to demonstrate,
Do
like
you
I
get
was
a Happy
saying,
Meal with it?
that the lesions are disseminated in both space and time. So that's what I
Mhm.
was just talking about with that patient, that the lesions have to be in at least 2 of the 4 CNS locations. So CNS is central nervous system. So periventricular brain, cortical or juxtacortical brain, infratentorial brain, or spinal cord. So 2 out of those 4 areas have to have lesions on them. And then evidence that these lesions have occurred at different times, meaning there wasn't something here, now there's something here. So a new lesion on a repeat MRI, or a simultaneous presence of both active, so they light up with the contrast, and old.
Mhm.
So that can also show time.
Yeah. 'Cause I guess the older ones, it's more of almost like a scarring.
Yeah, so they don't light up. So enhancing with gadolinium is the kind of contrast you use with MRI. So a gadolinium enhancing, it would be lighting up. So brain and spinal cord MRI, so top to bottom, will show what we call white matter lesions. And usually the radiologist can say, could be, they're always going to write, white matter lesions are very commonly found.
Mhm.
Could be ischemic, could be migraine, could be inflammatory, could be demyelinating. And when you see demyelinating, you're like, wait, is this MS? And then
Right.
do I need to be working this up?
So are there other demyelinating disorders?
So MS is the main one. There's another one, CDIP.
I feel like I was taught it, but I don't
Yeah,
know.
CDIP is another one. It's similar, but not exactly the same. But
Mhm.
that's the other main one. So another thing they use in the diagnosis is they can do a spinal tap to get cerebrospinal fluid analysis. And they're looking for very specific things called oligoclonal bands. And then, of course, a neurologic exam. And if you've ever seen a neuro exam done, it sounds crazy the things they have you do, but every little thing in a neuro exam that you do,
Mhm.
like physically examining somebody, can mean something. And I remember when we were at school being tested on like practice exams on people.
Mhm.
The neuro exam has so many
Yes.
things you had to remember.
My favorite was when you have to stand behind someone and snap and see if they know which ear it's coming from. You
Yeah.
have them cover their eyes, you check the quadrants, so much stuff.
So many things. What's interesting is one of your cranial nerves is for smelling. So we used to
Mhm.
have to
You have to
keep a
smell
little
bad
bag of
yeah.
coffee in our
Mhm.
thing.
Well, see, you did coffee. We had, like, several different, all really bad smells.
Really?
Yeah, and then they would have to, like, one would be, like, way too sweet, one was way too sour. Like, they were very distinct, not pleasant smells, and they
Yeah.
had to be able to name them.
Okay.
Yeah.
So, and then you have to, of course, rule out alternative diagnosis. So
Mhm.
other conditions, infections, other vascular things going on. And basically it's an autoimmune disorder where the immune system mistakenly attacks the protective myelin sheath. So myelin, if you think about, nerves are like electric wires, and electric wires, as we know, have usually some sort of a rubber, whatever, coating on them to protect them from things,
A
banging into
conductor.
them, messing them up. So the myelin sheath is that protective coating around nerve fibers. And so essentially when it's damaged, the nerve signals don't transmit as well because there's like a little ding in there, like the nerve got dinged a little bit. And so it involves a lot of cascades of things that happen. T cells and B cells become activated. They go across your blood-brain barrier. So that's like our peripheral body and our brain have sort of a system where certain things shouldn't get through. And then these inflammatory cells cause this whole cascade of more immune cells and so on and so forth, and it becomes sort of a vicious cycle. And so that destruction, around the nerve fibers and then damage to the nerves themselves. Some things can repair a little remyelination. You can't repair a nerve. They can somewhat remyelinate, but not completely.
Mm-hmm.
And so it's basically the inflammation is occurring everywhere. So your brain is on fire, sort of, as we talked about in that other episode.
Called Brain on Fire.
Correct. But those like plaques, those lesions, are the specific things you see, but there's just all kinds of inflammation going on all at the same time. So,
it's systemic is what you're telling us.
Yeah. And how do we treat this now? So we've come a long way. If you met somebody in the 80s or 90s with MS, you're like, oh, wow, sorry. Now you can live with MS. It is not a death sentence like it used to be. It's not easy. And as we see from her, portrayal of this is complicated. But in the early 90s, there was a first treatment where these interferons were injectable. And then later on, they developed these immunomodulators. Now there are some oral medications as well. And then now the newest generation are monoclonal antibodies, which there are a million. Every commercial you see on TV is for a monoclonal antibody for eczema, for Crohn's, for psoriasis. But essentially, that's a new way of creating drugs. That's too much pharmacology to get into there.
Wait, what did you call it? Myoclonal?
Monoclonal.
Okay. I was thinking of myoclonus, which is
that's a sign of a neurologic exam. So some of the treatment approaches, like escalation strategy, is start with low risk medication, escalate if the disease activity continues. I think in a lot of disease processes that are autoimmune in nature, this has flipped on its head, and now it's more about early intensive therapy. Start with something that's very highly effective, and then you can always back down, because that's more preserving of your function. So
we know that it's progressive. So it's like, might as well hit it with your best shot.
Right. So that goes for things like Crohn's disease, for rheumatoid arthritis, things that are destructive. By hitting it hard now, stopping the destruction. And if you can back off later, fine, but just stopping the destruction for now. For an acute relapse, high dose steroids, and usually intravenous steroids are the answer. Oral steroids are typically not enough. I mean, you can, but they're going to be very, very high doses.
Do the IV have the same side effects as the pill?
Yeah. Oh, yeah. You feel like you can't sleep.
Yeah.
You want to jump through your skin, moon face, but you want to clean the house because you have so much energy. Steroids are like amazing and horrible all at the same time.
Yeah.
Basically.
I mean, we learned that from the bodybuilders.
Yeah.
Who are taking it for different reasons.
Different kind of steroid, but yeah.
Yeah.
And then, there are then other things that you're just treating the symptoms. So treating the fatigue, some of the spasticity. So certain specific types of muscle relaxers are used in MS, mostly like something called baclofen, which is more for spasticity than it is.
Like similar to like what you would treat in like CP or something like that.
Exactly. Yes. Something you're going to treat their bladder dysfunction with one of these overactive bladder meds. You might treat their pain with a pain pill or gabapentin. So you're treating all the other things as well. And then of course, physical therapy, occupational therapy are huge, because as we've learned with stroke and other neurologic things, as much as you can't bring back to life a part of the brain or nerve that's been damaged, but your brain can rewire certain functions.
Neuroplasticity.
Exactly. So by strengthening things, creating new pathways, muscle memory. Therapy is so underrated. If every single person on this planet could get physical therapy, I would prescribe it. 90% of the things you can do physical therapy for.
Yeah. I think on the patient side of things, it's frustrating because they don't see the immediate effects, but we know that those long-term effects are huge. And so sticking with it, going every week or 2 times a week or whatever you're prescribed can feel kind of tedious, especially if you're not getting that immediate quick fix. And so I think that's why a lot of people don't stick with it, when it can cause so much progress in the long run.
And the other thing is cost, because you often owe copay for every visit,
or you get a limited amount of sessions per year.
Right. Like child who broke her foot, we're still going to PT for that. And those bills add up. And I'm fortunate enough that I can afford it, but not everybody can. And that's a big barrier to physical therapy. I've had many patients who are like, I can't pay $30, $40, $50 2 to 3 times a week as a copay. Like, I can't do that. And I understand that.
And that's when insurance is covering the rest of it.
Right.
Because
the rest
you
of
have
it
a
is covered.
diagnosis.
That's just your portion of it. So that is definitely a barrier. But in general, physical therapy, occupational therapy, any kind of exercise, stopping smoking, and then vitamin D supplementation can be helpful. And so, they're looking to the future. They have a new class that they're working on called BTKs, not the serial killer.
Not bind, torture, kill.
They're Bruton's tyrosine kinase inhibitors.
Okay.
And they're oral medications that can actually go across the blood-brain barrier so they can help with some of the inflammation. So there's some phase 3 trials underway for that. They're also working on something to remyelinate better. So there's something called clemastine that they're trying to use to repair the damaged sheaths.
That sounds like a name that would have come up in our goddess names.
Yeah, clemastine.
Clemastine.
And then some other things like an antioxidant called lipoic acid can help with some brain atrophy.
Did you say lipoic acid?
Lipoic, Lipoic.
I feel like I've heard that used for something else, but I can't remember
It's an antioxidant, so it's found in a lot of foods and things, so it's probably something on like labels that you've seen. And then simvastatin, which is a cholesterol medicine, they're showing may help slow disability. Something else, I'm not sure what this one is called, ibudilast, reduce brain atrophy as well. There's a lot of things they're working on.
Mm-hmm.
Some other calcium, novel immunomodulatory agents, stem cell therapy, which we talked about with her. So autologous hematopoietic, big words, stem cell transplant shows promise as a highly effective therapy for selected patients with aggressive disease. So that was why it really was super aggressive. So it was a good idea for her. And they're looking into using things like viruses to help with this. So Epstein-Barr virus, which is funny because that's the virus that causes mono and is implicated
I'm also laughing. I was like, it's not the Epstein you guys think it is.
But it's implicated in causing some cancers and some other things. Mm-hmm. But they're using that and possible preventative vaccines because there's a link between Epstein-Barr virus and MS now too, which I wasn't familiar with. So looking at that, and then they're looking at the microbiome because that's kind of the new frontier that we don't know enough about.
Everybody's looking at your gut biomes for all sorts of things because apparently none of us thought to look in the stomach for the last 100 years in medicine.
But do not buy those kits online that tell you they're going to tell you what you can and can't eat. Because that is, until we have the right technology, don't spend your money on those things. Yeah. And then restrict yourself unnecessarily. But anyway, it's something that really was a real death sentence that we have so much progress in. The earlier we catch it, the whole point of all of these medications is to stop flare-ups, which stops that additive disease. Yeah. So that's where we're at. I mean, with a lot of these autoimmune diseases, you got to stop the destruction so that you have less debility and less disability going forward. So
not that Selma owes us anything, but I would love to see like a 5-year post-documentary how she's doing. Like, even if it's like just a short thing about like, hey, like this is where I was back then, this is where I am now. It's because I think she's been so outspoken about bringing awareness of MS. And I think a lot of people really found that documentary and her journey inspiring for their own health issues. So I think it would be great if she was in the position to do so. I think a lot of people would really love to see where she's at and continue to cheer her on. I mean, I always loved her as an actress, but then after seeing that, I just loved her like
as
personality.
A person. Yeah. She definitely, even though she has low moments, she definitely, I didn't realize how much she has humor. Yeah,
gosh,
she really uses humor to get through a lot of things.
And one thing that has nothing to do with the MS, but she does talk a lot in that documentary about her childhood trauma and how, she didn't, even though she's a famous actress, she had a lot of stuff that she had to get through to become famous. And then, this kind of snuck up on her.
She was definitely of like that.
She was a 90s it girl.
Yeah.
Kissing Sarah Michelle Gellar.
Intentions, people. Watch it.
That was like one of the first big like on-screen like female to female kisses that like was not like X'd out and was like a big
if
deal.
You want to see a young Ryan Phillippe,
a very young and a young like Reese Witherspoon. This was before they got married and had babies together. Now their babies look exactly like them.
Yeah,
which is scary. Yeah,
but that movie was amazing. I mean, she was in quite a few things, but that's the one that stands out from like that era to me.
Well, because I feel like her character was so endearing. This like cute little innocent virginal girl who's now a pawn in this devious desires.
Now I need to go watch Cruel Intentions, and then I have to see it. I don't think it's child appropriate yet. But
no. Well, you can watch Cruel Intentions, but you have to watch what it was based on, which I've never seen, but I've heard is phenomenal. Dangerous Liaisons.
Yeah, no, I haven't seen
it's
that.
Meryl
That's
Streep,
like,
I think. Right?
Yeah, that's like before our time, sort of a thing.
Really, it was in the 80s. We were just
right.
little.
I mean, we were too young at the time. Yeah.
I mean, the teenage version was better, and that soundtrack, phenomenal.
Yes.
Every song on that soundtrack.
Yeah.
Just a bittersweet symphony. Okay, sorry.
My kids even know that song. That's one of those ones that they always play on the alternative station that I listen to on Sirius XM.
Yeah.
The 90s. I wish we could go back.
Let's pour one out for our homies.
Seriously. Take a drink.
Mm-hmm.
All right. So, yeah. I mean, that's what we got for MS. So, yes, it's a tough diagnosis, but there's so much coming for it. I think this is like a positive. I think we got to like look to the future and the technology that's coming. I think it's pretty awesome for these people.
Yeah.
And just get out there and don't be afraid to tell your provider if you have weird symptoms, or if not, find a provider that'll listen. Right.
And that's something I tell people all the time. If you feel like your provider, regardless of what type of provider they are, if you feel like they're not listening to you, go to someone else. It's a pain in the ass to find another doctor, the wait lists and everything. It's a pain, but in the long run, it'll be worth it, because feeling heard and seen by your provider, that is what everyone deserves.
Yeah. I mean, I think that, we're out there, two people fighting the good fight, but there are other really good people out there. So just talk to people. The best thing is like word of mouth, honestly. When you're looking for someone, talk to people like, who do you go to? Do you like them? Do you feel like they listen? Yeah. That's the best way. And that's how a lot of people, find me. Right now, I'm not even accepting new patients unless they are friends or family of a current patient, just because we're so busy. I can't.
Yeah.
But it's lovely, because then you have people coming in and you can help them and finally listen to them.
Yeah. I think something that both you and I do too, that I think more providers need to do, is not be scared to have the difficult conversations. Sit down and say, look, this is what we're seeing. This is what we're dealing with. This is the next step, instead of just dropping a diagnosis in someone's lap and then sending them on their way.
Yeah.
Because that does change, I feel like, the way that people then approach their treatment. If they feel like they can have that hard conversation and feel good leaving, then they're going to pursue the treatment.
Yeah, that's exactly, whenever I'm giving someone that kind of news, I always say, well, but we're going to focus on, this is the next thing we have to do. And then this is the next, like, instead of just feeling it and living in it, let's move forward.
Yeah, like we have a plan. Now we know what it is. Now there's a path forward.
Exactly.
Instead of spinning your wheels and wondering.
Exactly.
Yeah.
All right, so get out there and live and fight the good fight and listen to people.
I don't know what fight I'm fighting, but
we're
fighting against myself.
Fight of being good people that help people. I don't know.
We're all trying our best.
All right, thank you for listening to Medical Media Mixer,
the perfect cocktail. Cheers.
Thanks for tuning in to this episode of the Medical Media Mixer podcast. If you enjoyed the conversation, don't forget to subscribe, rate, and review us on your favorite podcast platform. Your support helps others find the show. Want to keep the conversation going? Follow us on social media. We're at Medical Media Mixer Podcast on Instagram, Facebook, TikTok, YouTube, and on Pinterest, the Medical Media Mixer board.
If you'd like to support the show and help us grow, check us out on Patreon, patreon.com/Medical Media Mixer Podcast. And on Buy Me a Coffee, buymeacoffee.com/Medical Media Mixer Podcast. If you have a topic idea, feedback, or just want to say hi, send us an email at medicalmediamixer@gmail.com. You can also stream all of our episodes and find more info on our website, medicalmediamixer.podbean.com. We're available on all major podcast platforms, so no matter where you listen, we're there. Thanks again for listening, and until next time, keep mixing medicine and media.